Understanding vestibular disease in dogs, causes, symptoms, and treatment. Introduction. Vestibular disease in dogs can be a frightening and sudden condition, leaving pet owners alarmed as their dogs struggle with balance and coordination. This disorder arises from a problem within the vestibular system, a complex network in the inner ear and brain that controls balance and spatial orientation. Dogs with vestibular disease may exhibit dizziness, unusual head tilts, rapid eye movements, and even nausea, creating a sense of urgency to identify the issue and seek treatment. In this article, we will delve into the nature of vestibular disease in dogs, its symptoms, possible causes, diagnostic approaches, and treatment options, while offering tips on managing the condition to ensure your dog's comfort and recovery. What is vestibular disease in dogs? The vestibular system is an intricate part of the nervous system that helps dogs maintain balance, posture, and eye stability. It includes the inner ear, brainstem, vestibulocerebellum, a part of the brain, and the vestibulocochlear nerve. This system allows dogs to stand, walk, and move without losing equilibrium, even during head movements. When any part of the system malfunctions, it leads to vestibular dysfunction. Dogs affected by this condition may experience vertigo, characterized by a sensation of spinning or imbalance. This disorder is sometimes referred to as old dog vestibular syndrome, as it commonly affects older dogs, although younger dogs can be susceptible as well. Recognizing symptoms of vestibular disease in dogs. Vestibular disease typically manifests suddenly, with symptoms that can be mistaken for other conditions like a stroke. Here are the most common signs to watch for. Dizziness and disorientation. Dogs may stagger, wobble, or have difficulty walking in a straight line. Head tilt. A noticeable tilt to one side is a hallmark symptom. Nystagmus. Rapid, involuntary eye movements, either horizontal or vertical. Falling or circling. Dogs may fall to one side or walk in circles. Nausea and vomiting. The dizziness often leads to nausea. Loss of appetite. Discomfort and disorientation can make eating difficult. Facial paralysis. In some cases, facial drooping may occur. These symptoms can develop abruptly, causing a once healthy dog to seem suddenly unstable or distressed. What causes vestibular disease? Vestibular dysfunction can result from various underlying issues affecting the inner ear or brain. Common causes include inner or middle ear infections. Inflammation in the ear can disrupt the vestibular system's sensors. Tumors or cysts. Growths pressing on critical nerves or brain areas may trigger symptoms. Trauma. Physical injury to the head or inner ear can impair balance. Hypothyroidism. While rare, this condition can lead to vestibular dysfunction. Vascular issues or stroke. Restricted blood flow to the brain may cause temporary or permanent vestibular problems. Idiopathic vestibular syndrome. In many cases, no clear cause is identified, especially in older dogs. Diagnosis and veterinary assessment. To diagnose vestibular disease, a veterinarian will conduct a thorough physical examination and review your dog's medical history. Key diagnostic steps include physical exam, assessment of reflexes, eye movements, and coordination. Blood and urine tests, to check for systemic illnesses like hypothyroidism. Imaging, X-rays, CT scans, or MRIs to detect tumors, structural issues, or signs of trauma. If no specific cause is identified, idiopathic vestibular syndrome is often diagnosed, particularly in senior dogs. Treatment options for vestibular disease. Treatment depends on the underlying cause. Here's an overview of potential approaches. Idiopathic vestibular syndrome, supportive care is the primary treatment, as symptoms often resolve naturally within days to weeks. Anti-vertigo medications, like meclizine, and anti-nausea drugs may be prescribed to ease discomfort. Ear infections, topical or oral medications are used to treat bacterial or yeast infections. In severe cases, debris may need to be removed under anesthesia. Trauma, supportive care and sometimes surgery are required for recovery. Hypothyroidism, thyroid hormone supplementation helps regulate the condition. Tumors or cysts, surgery, chemotherapy, or radiation may be necessary depending on the growth type and location. Dogs experiencing severe symptoms might need hospitalization for intensive care. Prognosis and long-term outlook. The prognosis for vestibular disease varies based on the cause. Idiopathic cases, most dogs recover fully within days to months, though some may retain a slight head tilt. Infections and hypothyroidism, these are highly treatable with proper medication. Trauma, strokes, and tumors, recovery depends on the severity and success of treatment, with some cases leading to permanent damage or recurrence. Preventing vestibular issues. While vestibular disease is not entirely preventable, certain steps can reduce the risk. Routine ear care. Clean your dog's ears regularly using vet-approved solutions to prevent infections. Regular vet visits, annual or biannual checkups can detect potential health issues early. Prompt treatment. Address ear infections and injuries quickly to avoid complications. If your dog shows signs of vestibular disease, seek veterinary care immediately to identify and treat the problem promptly. Conclusion. Vestibular disease in dogs can be alarming, but with early detection and appropriate care, most dogs recover and return to their normal selves. Understanding the symptoms, causes, and treatments helps pet owners navigate this challenging condition and ensure their furry friends receive the best possible care. Always consult your veterinarian at the first sign of trouble to give your dog the best chance of recovery. This video explores vestibular disease in detail, shedding light on its symptoms, causes, and treatment. Watch to learn how you can support your dog through this condition and ensure their swift recovery. Caring for a dog with vestibular disease at home. When your dog is diagnosed with vestibular disease, providing supportive care at home is essential for their recovery and comfort. While the condition can appear severe and distressing, creating a safe and stable environment will help your dog regain their balance and confidence. Create a safe space. Dogs with vestibular disease may struggle to walk or stand without falling, so designate a quiet, confined area to minimize the risk of injury. Use soft bedding to cushion the floor and remove any sharp or hard objects that could harm your pet if they stumble. Avoid stairs or elevated surfaces to prevent accidents. Assist with mobility. Your dog may need help getting up, moving around, or going outside for bathroom breaks. A supportive harness can make this easier and reduce the risk of falls. Be patient and give your dog time to adjust as they navigate their surroundings. Encourage eating and drinking. Dizziness and nausea often suppress appetite, but maintaining hydration and nutrition is vital. Offer small, easily digestible meals and plenty of fresh water. If your dog refuses to eat or drink, consult your veterinarian for advice. They may recommend anti-nausea medications or alternative feeding options. Monitor progress. Keep a close eye on your dog's symptoms, noting any improvements or changes. Recovery from vestibular disease can take days to weeks, but if symptoms worsen or new issues arise, notify your vet immediately. Provide emotional support. Your dog may feel frightened or anxious due to their disorientation. Spend time reassuring them with gentle words and petting to help them feel secure and loved. With proper care, patience, and veterinary guidance, most dogs with vestibular disease recover well, regaining their balance and zest for life.